Restor's been funding innovative and groundbreaking research for the last 25 years. They're a fantastic research charity, and they are always in support of sort of young researchers and innovative research. So yeah, we've been very grateful for the funding we've received from Restor. The project that we've been working on for the last 3 years is developing patient-reported outcome measures in burn care. So we've developed health-related quality of life questionnaires which patients complete when they're in hospital after having a burn injury, and really these are to identify patients' needs, so health professionals can better respond to those needs and really tailor the support that they're providing to patients' own individual needs. And they're also very important because we're able to identify how the treatment that they've received has benefited them over time. It's health-related quality of life, and so that covers physical well-being, so how much people can move, how much physical stuff they can do, as well as social, how much they can engage in social activities for children, how they find in school, for adults, how are they finding work, have they been able to go back to work, as well as emotional, and also trauma symptoms, which is often common when you've had a burn injury, as well as romantic relationships, and that those kind of relationships can be affected after a burn, and all those issues are key to well-being, which is why we've included them in the questionnaire. We've been very lucky that the British Burns Association has supported our work, and once these questionnaires have been validated within the NHS, they want to use them as mandatory outcome measures which all burn units will use in the UK. We hope by clinicians using these measures when their patients come into hospital, they will be able to really identify what are the key needs of this patient and which services does this patient need the most. Previously, outcome measures would normally have been completed by clinicians, and of course clinicians are key and very important for burn care and identifying patients' needs, but also more and more research is focusing on actually asking the patient what they need, and so that's what's more innovative about this research. And also previously, if they were using patient-reported measures, they might have been more generic measures, asking about their health more generally, but the key with our research and the measures that we're developing is that they are burn specific, so they relate specifically to the experience of them having a burn injury, and that's why we've done this research.